बता देना. Hey guys, this is Dr. Aman Setiya, your medicine faculty at LNX. So in this video, I want to resolve your confusion about how to choose a branch. So the best branch in India, that is like preferred by everyone, that is your radio diagnosis. So that is, in my opinion, wherever you are getting it, just take it. So before this, let us watch a video.
Hey man, MBBS क्या कर रही है? पीजी कर रही है किस चीज़ के डॉक्टर आप? रेडियोलॉजी. पता क्या होता है? पता है? एक्सरे निकालते हैं. तो तुम भी अपने आपको डॉक्टर बुला. You glorified photographers.
Okay guys, so come back to our main thing, this is what she's knowing nothing about this branch. So to avoid such stupid confusion, like these are people, those who create nonsense in the environment. So let us start our discussion with the branch versus career versus your college. So understand this thing, there are two things like branch and college. So depending on what branch you choose, so in my opinion, I just like, it may be different from others, but I'm just trying to give you an honest opinion. This branch is like your wife or your husband, and college is like the I can say the venue of your marriage. So after few years, let's suppose after 10 years, 20 years, 30 years, nobody will ask you what was your venue of your marriage, but people will ask you what is your specialty. That's very, very important. So I know this is the peak time. You have to choose your branch wisely. There are many students, always they make a mistake in choosing, they choose a wrong branch, then they are frustrated, they end up in frustration. So to avoid this, let us discuss the pros and cons of each and every branch. So I'll be talking here about the clinical branches, because these are those branches which are highly preferred in India. So starting with the first one, the top branch of our country, that is radio diagnosis. So you can see a lot of pros, that is there is huge money. So starting salary, you can easily get a good salary, means there will be around 3 to 3.5 lakhs in the beginning. That's very, very decent salary. Then you can see a decent work-life balance, there is less stress. And branch, and you can see it is a very top and well reputed branch. We call them doctor of doctors. So this is again, I'm telling you the same thing, wherever you are getting it, this is the best branch, radio diagnosis. If you talk about cons, again, we have few cons, like private setup is expensive, but again, you are a doctor, you can easily get a loan from this. So in my opinion, what I will say, in my opinion, if I want to give my opinion, there are no cons, only pros. So that is the branch called radio diagnosis. Okay, coming to next one, general medicine, so which is my specialty. So pros is a good money. Job opportunities are very decent. This is very, very important point. Means wherever you are, you will get a lot of calls कि यहाँ जॉब कर लो, वहाँ जॉब कर लो, इतने पैसे मिल जाएंगे, इतने. तो मीन्स आपको जॉब के लिए भागना नहीं है. Again, if you are settling your career in a second tier or third tier city, अगर आप एक छोटे टाउन में रहना चाहते हो, remember this MD medicine is king of the hospital. But again, there is a huge competition and there is high demand of super specialty in metro cities. So this is very, very important. Because understand, if you are living in place like Delhi, Mumbai, Jaipur, or big places like Chennai, Bangalore, in these places, remember, अगर आपको पेट में दर्द हो रहा है, people will prefer gastroenterologist. That's very, very important. Again, a second cons will be the 3 years of PG journey will be loaded with stress. There will be many night duties, so workload is more. But again, if you want to settle your career, I can say in a good, in a second tier city, or I can say suppose in a town, then you can make huge money in this branch. Coming to third one, pediatrics. So pediatrics, again, it is considered a relatively an end branch. So there are few branches which I will say like medicine, surgery, gynae, pediatrics. These are branches which are called evergreen branch. So again, it is the benefit of this branch is there's good money. Then you can see the best benefit, I can see it is considered relatively end branch. So compared when we compare this to medicine, it's relatively an end branch. There are good job opportunities and it's considered an evergreen branch. Now coming to cons, again, there is a workload more and there is increasing competition, but again, these are not that cons. Okay, coming to next, that is dermatology. Only one cons I could see, that is less seats available. Rest, there is no cons in this branch. All are benefit, means there is good money, no emergency, no stress, a good work-life balance, and it's considered a top and reputed branch. So this is like, these are the benefits of dermatology. Coming to general surgery, which many of you are thinking to take, so understand this general surgery. Again, pros, there is a good money. Like medicine, here also आपको घर बैठे जॉब मिल जाएगी, but there is a good surgeon swag. So then you can see the cons is, again, if you are living in a metro city, so medicine surgery almost they carry same disadvantage. So अगर आप metro city में रह रहे हो, then there is a need to do super specialty. Then remember, this is like I can say setup is difficult, and there is it's more responsible, and sometimes there are some trauma cases, emergency surgery, so they are risky patient. So these are benefits and cons of choosing general surgery. Coming to obstetrics and gynecology, so what I have one word for this branch is that it is considered best of both worlds. It is the only branch where you will get benefit of both medicine as well as surgery. So आप दवाई भी लिखोगे मेडिसिन जैसे, आप सर्जरी भी करोगे, you will do C-section, you will do normal delivery. So that is like again good money, job is good, घर बैठ के आपको job मिल जाएगी, well reputed branch. But again we have some cons, like there is more workload, there are emergencies, more sensitive cases, sometimes you will see there are many complicated pregnancies. So that is the cons, and there are many night duties. So many people, they get frustrated when they choose their career in gynecology. So because there are a lot of night duties, very hectic. Okay, coming to next one. This is your orthopedics. Again, good money. Emergencies, I can say these are not less. Even I can say emergencies are more nowadays. Then you can see well reputed, good money. But nowadays, what you can see a lot of saturation. Competition is more, and this is the only like cons which I can see, that is physically demanding in nature. And many times there are some complications which are not fully treated, so patient satisfaction is not fully achieved. Coming to next, that is ENT, ear, nose, throat. So again, a good surgical branch, emergency is less stressful, relatively end branch. So you don't have to do super specialty, and a comfortable schedule, means you can go to the hospital based on your own time. But compared to this, the money is the issue. Less money, less reward. So these are the two cons of choosing ENT. Ophthalmology. Ophthalmology, again, money is good, less emergency, less stressful, and end branch. Then if you talk about cons, you can see saturation. Setup is very, very expensive, and even the machines, the equipment of ophthalmology, they are very expensive. So again, there is a more corporate involvement, and there are many things which are not covered in insurance. So these are like pros and cons of ophthalmology. Coming to anesthesia, there is good money, there is no setup needed, there is good scope, there are fixed work times. So basically I can say it's relatively a chilled branch. So 3 years of I can say your PG, your residency in anesthesia might be hectic, but remember, after PG you will get a decent work-life balance. The biggest cons I can see in anesthesia is like every person, they want to make some extra money. That extra money you can make by opening an OPD. There is no benefit of opening an OPD. Like nowadays many anesthesiologists, they are opening like pain clinic. But remember, again, there is a limited growth, and the second drawback which I can see in this branch is there is a huge dependency. Means you are dependent on a surgeon, you are dependent on a gynecologist, so that is like a dependent branch. Coming to TB and chest. Again, this is like a substitute of general medicine, and many places you will see, again, you are working like in a periphery, in a town, then remember TB and chest, many people, they call them as pulmonologist. So again, there are many cases of COPD in India, asthma cases, TB, pleural effusion. So these all are under this TB and chest. So understand this, it's an emerging branch. Again, the benefit when compared to medicine, it's an end branch. Then what are the drawbacks or cons of this branch? So remember, relatively less money, right? And there's a limited growth. And second drawback, I can say, like many cases of TB. So there's a risk of some aerosol-borne disease which can be transmitted. Coming to psychiatry, which is again, there are many pros, good money, emerging branch, a good life, a proper work-life balance, highly demanded in metro cities because there are people with depression, with anxiety, with sexual problems. So again, a good branch, end branch. Then what are the cons of this branch? So remember, the biggest cons I can say is there is a stigma. What is the stigma? We call them as pagalon ka doctor. So that is the stigma of this branch, and sometimes it becomes boring and dull, and sometimes there are cases which are very difficult to understand, which are out of the box. So that is like some difficult emergency cases, sometimes difficult OPD cases we will see, and again the OPD setup will take some time. Coming to next is radiotherapy. Again, do not confuse radiodiagnosis. That is not glorified doctor. That is top-rated branch. Then we have radiotherapy. The biggest advantage of this branch, which I can say, is like with this branch you can do super specialty in medical oncology. This is the best benefit of this branch. Means you are eligible for DM in medical oncology. So generally you will see like a DM oncologist. You will see like they are either a general medicine or pediatric or MD pediatrics, or they are a person like who have done their MD in radiotherapy. And in fact, most of the people, they take radiotherapy in a view like in future they want to become oncologist. Then cons will be like, again, it is good to do in metro cities, but again, you can see like there are a depression because most of these patients are cancer patients. They are taking radiotherapy, so again the mortality is very high. There is escaping of income. Then you can see there are very few centers which are fully fledged. So only radiotherapy is not a good option, not a good option at all. But when you take radiotherapy in a view like I want to become a future oncologist, that is a good option. Again I am repeating, सिर्फ रेडियोथेरेपी नहीं लेना है, रेडियोथेरेपी लेके आगे प्लान करना है कि मुझे आगे oncologist बनना है, good branch. Family medicine, again it's a mix of all branch. Again it's a good branch for rural areas. The benefit which I can say, the only benefit is it is at least better than being MBBS. सिर्फ MBBS से बढ़िया तो ये है. Is it clear? Then coming to emergency medicine, so we have like again there is a good adrenaline rush. So बड़ा अच्छा लगता है when you see an emergency case जिसमें सबने उम्मीद छोड़ दी and you are saving the patient. Suppose there is a patient with VT, ventricular tachycardia, or a patient with I can say ventricular fibrillation, or a patient in shock, और आपने उसको बचा लिया. So that is like giving you some kind of kick or adrenaline rush. A good money, there are fixed decent hours, working hours. But again, there is saturation because most of these patients, like many times a critical care expert, when anesthesiologists, many times I can say general medicine people, they are also dealing with the same patient. So again, there is the next drawback I can say is in emergency medicine, there is no OPD. So these are some benefits and I can say pros and cons of each of these branches. So this is the time like I know you are filling your choices for the counseling. So just watch this video once because this will give you some idea, because sometimes suppose you are like when I was a student of your age, I was confused like I will take I can say psychiatry, or I will take general medicine, or I will take pathology, or I will take pharmacology, because these were four my favorite subjects. Then slowly I ruled out these two subjects. Means I ruled out psychiatry, I ruled out I can say I ruled out psychiatry, I ruled out pharmacology. Then like I made a mistake, like I took MD pathology. So pathology is like medicine in the beginning, but later on I realized there is no patient interaction. So that is why do not do the mistake which I did. Choose your branch wisely. Very, very important. Like in pathology, you will not see the patient. You cannot you cannot have an OPD. You are just sitting in lab. So same thing in like suppose if you are taking your career, I can say in emergency medicine, again you will not have OPD. So there will be no backup. So OPD is what we call this in like in short form, what we call it PP. PP means private practice. So that is something which is an additional income, which like after your tenure of life, you will realize that there are many doctors, ultimately they are settling them in private practice. Is clear? So again, these are the pros and cons of clinical branch, and these are the branches I know which you are filling in your choices. So this is again an important video. If you want me to make a video non-clinical branch, so you can put in the comment box. I'll try to make the pros and cons of non-clinical branches. Thank you so much. Just remember one thing, like whatever branch you feel, like I like this, I can do a wonder in this, take that branch. This is from my side. All the best. Keep working hard. Bye-bye.